Hello, I'm Leanne Teaney.
And I'm Stephanie Koehler from Cutting Edge Counseling in West LA.
We're here to talk just a little bit about trauma. So, Stephanie, why don't you kick us off with a little talk about single incident trauma?
Okay, so in general, we separate trauma into two main categories: single incident trauma and developmental trauma. So, single incident trauma takes place in a discrete period of time. So, it could be a car accident, invasive surgery, an assault.
Yeah, a rape, things that are sort of discrete and short term.
And it could be something as big as 9/11.
Right, right. And as opposed to developmental trauma, which is more about your growing up experience and what it was like in your childhood. So it's a longer period of time, and it's sort of like the air you were breathing, right? So it really informs everything, like growing up in an alcoholic household or
Violent household, neglect. It could be that you have a family member who is chronically ill and all the resources in the family, financial and psychological, emotional, go towards that person.
yeah, or it could be social factors like poverty or racism.
And a lot of times, because it's the air you breathe, people don't understand that that's actually developmental trauma because it's experienced as this is my life. This is what regular life looks like.
Right.
So one of the things about single incident trauma, if you don't have a lot of developmental trauma, oftentimes we can heal that very quickly, often astonishingly quickly.
EMDR is great for that.
Yep, and we happen to mix EMDR and somatic experiencing together, so we don't have to decide it's going to be this or it's going to be that.
Right.
But it can really be moved quickly, and just about everybody has some kinds of single incident traumas that happen to them.
Whereas something like developmental trauma, took a long time to form and it's going to take longer to resolve. But again, we do have very effective therapies, right? There's a lot of hope for resolving developmental trauma and getting some relief. And so be sure to give us a call because...
Oh, I want to add something.
Oh, please.
Well, the good news about the developmental trauma is you don't have to go into therapy for years and finally feel better. You come into therapy and you just start feeling better over time. So it's incremental improvement.
Yeah, yeah. And often people feel better just by coming in the first time, right? Just making that first step.
This is true.
Not being so alone with it.
Yeah. So call us.
Thanks for your time.
Okay. Thank you.